to do it very efficiently. Marcin, would you like to sort of lead us off?
Yes, Mr. Chair, so you're calling the meeting to order, is that correct?
Yes, please.
Okay, thank you. And this meeting is being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Connecticut Television Network is also recording this meeting for a later broadcast. Thank you, Mr. Chair.
Thank you, and welcome to C-SPAN for the meeting today. Could I have a roll of the directors present, please?
Yes, Mr. Chair. Charles Klippel.
Yes, present. Thank you.
Paul Philpott.
Here.
Grant Ritter.
Here.
Dietrich Gifford. Steven Hernandez. Matthew Brockman. Thomas McNeil.
Here.
Thank you. Dina Berlin.
Here.
Thank you. Andrea Barton-Reeves, DSS Commissioner.
Here.
Thank you. Kathleen Holt from OHA.
Here.
Thank you. Claudio Gualtieri from OPM.
Here.
Thank you. Alexander Borkowski from SID.
Here.
Thank you. Manish Jutani from DPH Commissioner.
Here.
Thank you. And Caroline Zambetti, designee for Nancy Navarrete, DMS Commissioner. Thank you. We don't have a quorum, Mr. Chair.
Thank you, and thanks again. Welcome to everybody. James, could I ask you and then your team to introduce themselves as well?
Absolutely. Good morning, all. James Michelle, Access Health Connecticut.
Hold on one second.
Gina Walsh, Director of Operations, Access Health CT.
Good morning, Holly Zwick, Director of Finance, Access Health CT.
Good morning, Susan Ridgeby, Director of Legal and Governmental Affairs, Access Health CT.
Good morning, Caroline Roulette, Director of Marketing, Access Health CT.
Yes.
Good morning, John Carbone, Director of Small Group Broker Support and Product Development, Access Health CT.
Good morning, everyone. Glenn Jurgen, Director of Human Resources, Access Health CT.
Good morning, everyone. Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
Good morning, everyone. Marquise Davis, Director of IT, Access Health CT.
Thank you all. Appreciate it. And again, great to see you all. I understand we have no public comments. Is that correct, Marcin?
That is correct, Mr. Chair.
All right. So if not, we'll move to the next item, which is the minutes from the last meeting. Are there any comments, questions, or corrections to the minutes from the last meeting? If not, I would ask for a vote, first a nomination and then a vote to approve the minutes for the last meeting. Could I have a motion for that approval?
Yeah,
So
hi,
moved.
this is Fran.
Move
Motion to approve.
Okay, I'll take one of those as a motion and the other as a second.
Dr.
Marcin,
Ritter, and the motion was made by Grant Ritter, and the second was made by
Tom McNeil, maybe.
Mr. McNeil. Okay. Okay. Is there any discussion on the motion before us?
If no discussion, then Charlie Klippel, yes.
Thank you. Paul Philpott.
Yes.
Grant Ritter.
Yes.
Dietrich Gifford. Steven Hernandez. Matthew Brockman. Thomas McNeil.
Yes.
Dina Berlin. Ms. Berlin. Andrea Barton-Reeves.
Yes.
Thank you. Kathleen Holt.
Yes.
And Claudio Gualtieri.
Yes.
Thank you.
Thank you all very much. Okay, James, the floor is yours.
Thank you, Mr. Chair. Good morning, all, and welcome to our September board meeting. I am James Michelle, the Chief Executive Officer of Access Health Connecticut, and thank you for joining us today. Today's meeting is only for 1 hour, so let's get started. We have a full agenda. This summer, we had 9 interns at Access Health Connecticut that work for us. They're from schools including UConn, NYU Law School, Capital Community College, Quinnipiac University, and Howard University. All of our interns were fully engaged and were great assets to the organization throughout the summer. Not only did they work on projects for their respective assigned departments, they also completed a group project that saved us a lot of money and also helped us move forward in a particular area that we had not worked on for about 10 years. They created an inventory database of all of our assets, which is something we had not done for 10 years. This type of project typically can cost between $50,000 to $100,000 if you got an outside firm to come in and do it for you. So we think that the project was very successful. We believe they learned a lot. They walked away. We posted online with a lot of great comments about their experience at Access Health. Now, moving on, we will spend time during this meeting discussing the impact of the One Big Beautiful Act, which the President signed into law on July 4th, along with other federal changes. As you know, we have been tracking this bill closely and have kept the board up to date throughout the summer. We have also shared information regarding the final rule on marketplace integrity and affordability, which was issued by the Department of Health and Human Services in June. In addition, the enhanced premium tax credits that were created through the American Rescue Plan Act in 2021 are set to expire at the end of this year. We've been working very closely with my colleagues across the country to advocate for their extension. And there's some stuff is happening behind the scene, but that I'm not able to speak about right now. But they are working on it. But right now, we are planning as if they are not going to be extended. So we're planning for the worst. And but if all of these things take place, we estimate that the total impact of these federal changes may result in 30 to 35% of our currently enrolled Access Health customers becoming uninsured by 2034 simply because of affordability. And the cost of health insurance will rise significantly for the remaining customers. Susan Richby, Director of Legal and Government Affairs, will review these where things stand today and what we are doing to minimize the impact to our customers. Our meeting today will begin with a 2026 rate review presentation by Wanchin Shu of the Connecticut Insurance Department. Following that, Susan will give her update. Then Katie Hearn, Associate Director of the Enterprise Project Management Office, will provide an open enrollment update, readiness, covering technology changes to our system, product development, marketing and outreach preparation for the upcoming open enrollment. I just want to remind our board and as well as the public that open enrollment starts on November 1st, 2025 and will run through January 15th, 2026. And then after Katie's presentation, John Carbone will give the board an update on the Business Plus platform, successfully launched on July 1st. So far, we are marketing to nonprofits in Connecticut, and once that's well established, then we will move on to all businesses with a focus on small businesses that could benefit from an alternative to traditional group health plans. But also, I just want to give the board a heads up. John will talk more about this. This past Tuesday, John Carbone and I had the opportunity to speak with the state of Maryland exchange. They are very much interested in using our platform to help their small businesses in the state of Maryland. So the conversation is ongoing, and we hope to keep the board updated. We'll be discussing a contract between us and them, and what the future looks like. But right now, it's just a quick update on where we are with that. And also, after John, Glenn will give you an update on human resources. They had a meeting last Thursday. John will give a quick update on the status of our staff. Then Tammy, Director of Health and Human Health Equity and Outreach, will share the latest Broker Academy news update, where we are. And we have over 100 brokers that we have licensed, that we have helped obtain the license, that are currently working for Access Health and giving access to folks who before that did not have access to anyone in their communities. that looked like them, spoke the language, and understood their culture. So we are making progress in that respect. And Mr. Chair, at this point, I would pause for any questions.
Are there any questions? One quick comment, which is your meeting with Maryland. I'm sorry, before I do that, Commissioner Reeves.
Thank you, Charlie. I do have a question regarding the 30 to 35% of customers that may be uninsured by 2034. Are there more specific numbers that you can provide year by year? Is there a specific year that will be a peak year, or is it steady overall? I just want to understand what that trend might look like.
Okay, so we have the data. We believe over the years there'll be a gradual decline towards that number. And again, the 30-35% reduction basically will be going back to before the enhanced subsidies. Just think some folks will go through a process as it becomes more expensive for them, not affordable. They're just going to gradually drop off, and we don't have any data, historical data to trend by year. But what we do know is that it'll become unaffordable, and again, the 30-35 reduction will be it's a reflection of pre-enhanced subsidies support.
Okay, so there wouldn't be, I guess I'd like to work together to see if there's a way that we can try to figure out who those people might be. I know it's very unpredictable. People drop off for all kinds of reasons, so that maybe we can start mapping them to Medicaid programs that they might be eligible for, so that we can try to reduce that number a bit. But we can talk about that.
Well, we think most of those folks are folks who would not qualify for Medicaid.
Qualify, yeah.
They would not qualify for Medicaid.
Understood. But
the income level is just too high. And it's just not affordable for them.
Understand. Want to check, but because there might be a cascade of events that might make them eligible. We're just looking at it from a different perspective. But thank you. Well, you and I will talk more about that. So thank you.
Yes. Claudio has a question.
Claudio, yes, thank you.
Yes, thank you, Mr. Chair. Just picking up on Commissioner Barton Reeves' question. If we know anything about the subset of individuals that are losing coverage, because I think, James, I've always been under the impression that it's going to be the over 400% of FPL, those people that were part of the original benefits cliff under the ACA that sort of got filled in with the Inflation Reduction Act subsidies, and maybe certain legally here citizens who are not yet eligible for Medicaid. And I think on that second subset, under 100% of FPL, losing all access to subsidies while they wait their 5-year period. Maybe that's a group that we all can be thinking about with Commissioner Barton Reeves to get them on a fast track. So we're doing all the pre-work so that when they meet the other requirements, they can easily slot into the Medicaid program. Do you have any other insights on the demographic profile? Because the piece that I'm also concerned about is, are we expecting that 30 to 35% loss comes from relatively healthy individuals? I suspect if someone really is going to be a high utilizer of care and needs it, the value proposition for paying whatever the price is, even if it goes up, may be different than someone who's relatively healthy. So any sense on what it does for the risk profile of who remains on the exchange, the 70% or so that stay?
So Claudio, the less than 100% of FPL, we have that number. We've been tracking that. That's about as of late August, it was about 5,300. So we know who they are, where they are, and they will lose coverage almost immediately. But we don't have claims information. We don't have access to any claims information. So the second part of your question, it'd be hard for us to kind of give you an answer as to exactly which group within the 400% cliff is going to stay. But we anticipate, and that's right now, it's about a 28,000 member group for us. And our goal is to do a lot of communication and also leverage our brokers to help them shop, find something that's affordable for them. But we don't have any claims information to try to assess which group are the high users of claims of medical services. to try to assess who's going to stay, who's going to leave. We just don't we don't have access to that information.
It may be worthwhile to think through potentially fielding a survey or seeing if we can't have voluntary survey from people who drop off the exchange, just to get some extra granular feedback on what those subpopulation and decision points are that we could plan policies around.
Yeah, we do that every year. Well, we do a leaver survey every year at after open enrollment ends. So we plan on doing it this year as well. Every year after open enrollment, we do a leaver survey to try to assess. Last year you had insurance with us. You did not renew. Why? We do that every year. We think we get the board an update January, February. So we'll come back to the board with the leaver survey results after open enrollment. So you will have access to that information.
Thank you so much. Yeah, I think this year there's going to be a particular interest. If things don't get extended, I think that there's going to be a very much we need to look at that survey and the findings. Thank you, James.
Will do. Thank you.
James, I wonder if our carriers, forgive me, I wonder if our carriers haven't done a bit of actuarial work on exactly Claudia's question. That is, what's the likely risk shift associated with this? It might be worth just asking them if they've done that work, and if so, if they could share it with us, understanding that it's probably preliminary.
Will do. We'll follow up with them.
Thank you. All right, good questions. Any further questions? If not, then I was going to first of all just applaud James, you and the team, for really, I think, being in the lead on ICRA. So it's interesting that other states are beginning to follow your lead. I think that's great. Susan Rich Bai, I think you're up next. Thank you.
Thank you, Mr. Chairman. I think I'm just going to introduce our actuary that is here to present for us from the insurance department. So as some of you hopefully know, or all of you hopefully know, Access Health CT is not a regulator, so it is the Connecticut Insurance Department that does all of the rate approval for the plans for 2026. So here with us today, we have Wanjin Chow to present on the literally just released last week rates for 2026. So I will turn it over to him. Thank you very much.
Thank you, Susan. It's my honor to join your board meeting today, and good morning, everyone, and the chair and every board member here. I'm Wanjin Chow, Chief Actuary, Assistant Deputy Commissioner for the department at CID. And so this is just a quick review of what we have done for the 2026, the health rate itself. So the scope of the review is we have 7 companies, entity, and then we have the A rate filing on individual and small group, and this is related to 224,000 cover life in Connecticut. Next slide, please. And with the rate change, I know this is the year with many uncertainty, but the major reason for the rate change here, I have to summarize the 3. One is the annual trend. The medical inflation trend is a factor that accounts for rising healthcare costs, including the cost of prescription drugs, the increased demand of medical service, and the severity of future claims. Health insurance premiums are affected by several key factors. The medical costs have surged by 6 to 10%, and prescription expense have risen by approximately 9 to 15%. And this increase are primarily driven by higher healthcare utilization and greater disease severity, which lead to advanced stage treatment and an overall increase in healthcare spending. Next slide, please. And the second piece is the experience adjustment. The experience adjustment is necessary, and that's how we review all the annual rate change subject to reflect the deteriorating claim experience with the prior rating period to the current rating period. And as you know, actually we just the usual based on the past history and then forecasting for the future. And the third item is quite significant this year, and that's the total increase request, include the amount request, including the impact of the enhanced federal subsidies expiring December 31st, 2025. And this enhanced subsidies was enacted as part of American Rescue Plan Act of 2021 after COVID-19. And so this slide will show you the on exchange individual, and the next one will be small. And so the on exchange individual, we have Anthem Health Plan. The initial average request 14.2%, range from 6.4 to 22.8. And the final average request 18.6%. And the reason you have this 18.6%, that's the reflection of this kind of subsidy expiration. And so I know earlier discussion was talking about the estimate. So the carrier does include that. So into their calculation, say if that expired, then that's the 18.6% coming from. And so after the Connecticut review that, we approve on the 13.6% with the range 6.1 to 22.5%, and this will impact 83,790 cover life. The next one is the CCBI, and the initial request 21.7%, range from 4.7 to 26.7, with that subsidy adjustment, that's 28.5%, and then we approve 20.6% with range 3.5 to 25.6, and this impacts 7,160 lives. And then the Connecticut Care Insurance Company, Inc., initial request 26.1 with range of 5.9 to 28.6. The final average request 34.5, and we approve 20.3 with range 1.1 to 22.7, and this will impact 3685 cover life. Next slide. The next slide is the only company with the on-off exchange small group and Anthem Health. And you can see from here, the subsidy piece does not impact the small group, only individual. So the initial average request 13.2 with range 7% to 16.6, approval rate 11.2 with range 5.1 to 14.5, and it will impact 48,666 cover lives. Next slide, please. Then we are going to talk about the off exchange, and for the individual, that's the Connecticut Care Inc. Initial 5.9% range from negative 0.9 to 6.7, approval average 7.7 with range 0.8 to 8.5, and this impacts 738 cover lives. Next slide. And this is the slide for the small group of exchange. So we have Oxford Health Plan Inc. Initial request 12.8, range 10.4 to 14.7. We approve 10.3% with range 7.9 to 14%, and impact 983 cover life. The next one, Oxford Health Insurance Inc. The initial average request 12.9, and the range 11.6 to 20.4%. Approval average 10.4 with range 9.1 to 17.6, and this impact 14,663 cover life. And the next is the United Health Insurance Company. This is the 13.1% initial request, range 9.2 to 16.3, and the approval average 10.6% with range 6.7 to 13.6%, and that will impact 1503 cover life. And I think that's the end of my high-level review for this 2026 health insurance rate change. And I will stop here and to see, do you have any question?
Mr. Chair, I think you're muted.
Yes, I am. Sorry. Thank you very much for the presentation. We really appreciate it. Are there any questions regarding this data? Hearing none, then thank you again very much for joining us today. Mr. Hao, we appreciate your input.
Your Chair, and if no further question, I will just drop off and then you conduct your regular board meeting. Thank you, everyone.
Thank you. Susan Rich Bai, I think this is also one of your topics.
Thank you, Mr. Chair. Susan Rich Bai, Director of Legal and Governmental Affairs. And I will just note before I go into this presentation, and sorry, there's some background noise here, that next month, Wakely Consulting will be doing the consumer impact study that we do every year. So it will take that information that was just presented to you on the rates and actually show you the real impact on Access Health CT consumers with subsidies and real consumer examples at income. So you'll have more detail to look at that. So as James mentioned, there are a multitude of federal changes that are going into effect starting for this year, 2026 and beyond. So for this presentation, we're going to focus mostly on those for this year and 2026 for right now. So they come from 3 different areas. James mentioned this, the reconciliation bill that was signed into law by President Trump in early July, the final rule on marketplace integrity and affordability that was published by the U.S. Department of Health and Human Services on June 25th, and also something we've been talking about for quite a while, the likely expiration of the enhanced premium tax credits that went into effect in 2021 under the American Rescue Plan Act and are set currently to expire at the end of this calendar year. Next slide, please, Martin. So let's break this down and look at some different areas. So from the reconciliation bill for 2026, as I think Claudio and somebody mentioned earlier, there are various eliminations of eligibility for financial assistance for different groups. So one that goes into effect for 2026 is eliminating eligibility for federal financial assistance for individuals who are lawfully present but not eligible for Medicaid due to their immigration status, and for those people that have income below 100% of the federal poverty level. Previously, and up until this point, they've been eligible to enroll through the exchange and receive financial assistance, premium tax credits, and cost-sharing reductions, and nearly all of them are because of income in the Covered Connecticut program. But starting in 2026, they will unfortunately lose that federal financial assistance. As James mentioned, that is about 5,300 people. The final rule has a number of changes that go into effect for this year, 2026 and beyond. So one that's going into effect right now in 2025 is eliminating eligibility for DACA recipients. And this started in this plan year, and Access Health CT is rolling this out for consumers enrolled through us at the end of this month for September 30th. We do have a lot of messaging going out on that. It also eliminates the special enrollment period for consumers with income below 150% of the federal poverty level that has been in place since 2021. Fortunately, in Connecticut, we have the Covered Connecticut program with year-round enrollment as a landing spot for these consumers. It also shortens what has been over the last 2 years, a 150-day period to submit information if requested to verify your annual income. It takes that back to the 90 days, and the 90 days is what is in place for the other items that consumers may sometimes have to verify. Now, these 2 items below it that are in bold here are under the rule scheduled to go into effect, but you've probably heard, and I believe we sent a memo to the board, there was a case with a ruling out in August that put a stay in place for a number of items. And these items here are currently covered by the stay, so they are not going into effect right now. And those are a number of different ways making changes to the verification process for income, for different types of areas for consumers. And also there was an item in the rule that would allow carriers to require consumers who had past due premium debt to satisfy that first before their payment would be used for a new plan year. That is currently on hold as well. And then finally, probably the one with the most impact across the board is the likely expiration of the enhanced premium tax credits. This does make less financial help, federal financial help, available for Access Health CT and across the country for consumers receiving this premium tax credit assistance. But we do want to make sure that we keep making clear to people that this is not all financial help. There are still federal tax credits and cost sharing reduction subsidies that will be available. It does importantly put back the cliff at 400% of the federal poverty level. I think Claudio mentioned this earlier. We currently have about 28,000 consumers who are receiving subsidies through us, who are at this income level. They will no longer be eligible for any federal premium assistance starting in 2026. And likewise, it also increases the cost for the state of Connecticut to fund the Covered Connecticut program because all of the premium tax credits will get smaller. You go to the next slide, Martin. As James mentioned, and there was a lot of discussion on this, we've looked at all of these different factors and we've estimated, and this is just an estimate, but we do think that it's possible that 30 to 35% of our currently enrolled population, which is 155,000 individuals, that 30 to 35% of those consumers may become uninsured by 2034. They are in different groups. Claudio was asking about numbers. There's 5,300 who are not eligible with the income below 100%, who will lose eligibility starting in 2026. About 28,000 who, if the enhanced premium tax credits go away, would not be eligible for financial assistance. And then there are a number of other changes that go into effect in 2027, 2028, and beyond. So if you look right now, we have 90% of our population subsidized. That's about 142,000 people. Pre-ARPA, we had about 69 to 70% of our currently enrolled population subsidized, which was probably about an average of 75,000. So that's kind of the difference that we're anticipating could happen. We hope it wouldn't, but it could happen. But we, again, still want to... Sorry,
quickly,
James.
Commissioner Reeves and Claudio, we segmented the population that would be impacted to craft our messaging to them. So I think we have that broken down already. So maybe we'll schedule a meeting with you, Commissioner Reeves, and your team to look at it to see those that are being impacted. Could there some way, some fashion qualify for Medicaid and maybe other services that DSS offers? So we'll be following up with you on that one.
Okay. I'd like to include OPM in that. I'd like to include Claudio as well.
Yeah.
Okay.
Yeah, we'll invite you, both you and Claudio, and you forward to your teams as you see fit.
Okay.
Sorry,
Thank
Susan.
you. No problem. And Claudio, do you have a question right now?
I was just going to ask, it seemed to me that one of the weird ironies of the below 100% losing all subsidies is that if they actually earned 101% of FPL, if they made a little bit more money, they get subsidies.
That is correct.
Group. And so I wonder if part of the strategy, in addition to figuring out the 5-year period and streamlining to Medicaid, is in the interim, how close are they to getting just above, and can we connect them to work, maybe PCA shifts or gig work or something, just to get a little bit more income and unlock all the subsidies? Because it just speaks. It's very ironic to me that the poorest of that legal status class are the ones that are losing everything, but make a little bit more and you're going to unlock all these subsidies. So maybe there's a strategy with subsidy unlock.
Claudia, what I can tell you is that the immigrant population is very resourceful, and I'm pretty sure they'll figure out in how to make that work. And the way that we can help them, we will.
Yeah, thank you. That is a good point. That is correct. And the reason, you know, it was a special category for them to be eligible with income below 100 is that 100% of the federal poverty level is the floor, the absolute floor, other than that exception for receiving premium tax credits. And that really is more in place other than this immigrant group in states, non-expansion states that didn't expand, because otherwise our floor in Medicaid, if you will, for adults is 138%. Our ceiling, sorry, for Medicaid is 138%. So we don't, other than this kind of population that is not eligible, we wouldn't have too many people between 100 and 138. But yeah. If you go to the next slide, Martin. So what do these numbers look like? I kind of touched on this already a little bit. There's 142,000 consumers currently enrolled about receiving federal financial assistance. And of that group, 50,000 of them, or just over 50,000 of those enrollees are in the Covered Connecticut program. If you go to the next slide, please, Martin. So what can we do about all this? As always, Access Health is always thinking about and working on what can we do? How can we help consumers? We work very closely with the Department of Social Services and OPM in the state. When the Medicaid unwind went into place in recent years, this is another challenge that we're gonna, really throw all our attention and resources into. So I think James mentioned this. Tammy and her health equity and outreach team use a community-first, data-driven approach. So we have the data to know where the need is, and we really have all of those community organizations to really partner with. We've added 4 new mobile enrollment specialists to increase the workforce that is able to help in person, and we will be holding enrollment fairs around the state and having an increased navigator presence, as always, activating those trusted resources in the community to help us better connect with people. What are we doing on the marketing front?
Susan, before you go to
sorry,
marketing
James.
very quickly, I just want to add one more comment on the health equity and outreach. I think Tammy may cover that when she gives her report. That
Yes.
given the current immigration climate that we are all in, so as Tammy has developed her and her team's approach to outreach this year, we are keeping that as part of our thought process. And given that some folks may be concerned, or out of concern of ICE, their shenanigans out there, they may not come out because of fear of how this may impact them and their families. So that is part of our thought process. We come to some creative ways to continue to give them access, even if they're not willing to come out. So just keep that in mind. That's part of our approach this year. We're doing some creative stuff to make sure people continue to have access to us, even though they may not come out. And most immigrants like to come out to the events in person. But this year, this may be a little different because of what's going on around the country. And so we designed our outreach this year to account for that as well. Sorry, Susan.
No problem. Thank you, James. This is also vitally important. Caroline and her team in the marketing area, as always, focusing on clear messaging. There's a lot of different information here. We want to really hone it down to what consumers need to know, what's impacting them, and using mail, email, and text messaging for direct-to-consumer messaging, and hope I'm not stepping on toes for later presentations. Also, a mass media campaign to keep reinforcing the messaging. And as we've been saying here today, the most important message is to remember that there is still federal and state financial help available. And we do have an array of plans at different levels and price points. So it's vitally important for 2026 that consumers shop and compare and see what's best for them. Really use a broker to help you pick what's best for you and your family. And as always, we have free help in person, online, and over the phone. Also, in operations and technology, we have increased the call center staffing in anticipation of increased call volume. And it's fortunate timing that we have 2 big technology updates in our call center that will be really important and helpful, an enhanced interactive voice response system, IVR, and also a new feature for call center reps to text links to helpful website URLs. We have a number of articles on our knowledge base on our website, and we've also launched a federal changes landing page. So we'll be able to really help consumers get that information and making the changes that we need to make to our system to accommodate all of these changes. So I think that is my last slide, and I will pause for any questions. Thank you.
Thank you for all of that, Susan. Are there any questions? There's been talk, Susan, about the possibility of a copper plan. Do we have any update on whether that might be actually happening?
I'm not sure if, well, I haven't seen anything about a copper plan. I don't know if you're referring to the changes HHS put out very recently about exemptions for people over 30, expanding the exemptions for people over 30 to buy catastrophic.
Yeah, I think it's basically that idea, yeah. Do we have an impact if that were to happen? We know what
and James, I don't know if you want to speak to this. So we are fortunate. Access Health is one of a very small number of state exchanges that handle our own exemptions for consumers in-house in Connecticut. We don't use the federal platform to do that. So we do have control about whether we expand that exemption or not. So James, I don't know if you want to speak to that or you want me to speak to that.
Go ahead, Susan.
So we've been looking at it, and obviously it's not a great thing. I mean, it may give people, access to other plans, but they are, not as comprehensive coverage as the other plans, and there is no federal financial assistance. So, and it is a separate risk pool for the risk adjustment program. The catastrophic plans are separate from the rest of the individual market. So as I think Claudio and other people have talked about, it's not great from an actuarial risk viewpoint, because you may now be driving healthier risk away from the individual market and the risk adjustment for that. So James has been thinking about that and considering what is best to do.
Understood. No, that's helpful. All right. Thank you very much, Susan. Any other questions?
Charlie, if I could just give a comment.
Yeah,
I just want to publicly express appreciation for Access Health. I know they do so much to keep the board informed, but I think they took an outsized role in getting ahead of some of the federal rules changes, anticipating and advocating, making sure that our congressional delegation knew early on the impact of the expiring enhanced subsidies, trying to help us at OPM and DSS think through what are other states doing, what options do we have, what are the operational challenges to doing that, and just wanted to publicly acknowledge them as thought leaders, true partners in keeping us informed with honest, factual information at a time when I think there's a lot of anxiety and concern, and making sure that, as the secretary would say, we're focusing on chopping the wood that's in front of us and what are the immediate changes and what our options states have. So thank you, James. Thank you, especially Susan, for always being such a good conduit of information. Thank you.
Thank you much.
Terrific. Terrific. Thanks, Claudia. No further discussion on that issue then. I think Katie, the floor is yours now for a readiness update.
Thank you, Mr. Chair. Good morning, everyone. I'm Katie Hearn, Associate Director of the Enterprise Project Management Office, and I'll try to walk quickly through our open enrollment readiness updates today regarding technology, marketing, and health equity and outreach. So first, as James said, our open enrollment period this year, OE13, will be of the same duration as it was last year. It will be held from November 1st through January 15th. And all of our departments have been meeting regularly to prepare for it. And in addition to our usual OE activities, Access Health Connecticut has been preparing for implementing changes due to HR1, the One Big Beautiful Bill Act, and the 2025 Marketplace Integrity and Affordability Final Rule issued by CMS. Each year prior to open enrollment, we make sure our enrollment system is prepared with a system release, and that release is on track for October 10th this year. The release changes will include the likely expiration of enhanced subsidies for eligible households at the end of the year, a change for DACA individuals who will no longer be able to purchase insurance through the exchange, and another eligibility change, which we've spoke about, affecting certain individuals not eligible for Medicaid due to their immigration status whose incomes are below 100% of the FPL. They will no longer be eligible for tax credits in 2026. Next slide, please. For open enrollment this year, eligibility projection notices for qualified health plans and for standalone dental plans will be generated and sent to customers between October 17th and 24th. And auto renewal notices for QHPs and dental plans will be generated and sent to customers between November 16th and 25th. Each year, next slide, please. Prior to open enrollment, plans are available to browse on Access Health's website. So window shopping will begin as usual the last week of October. And again, OE will begin Saturday, November 1st. On this slide, we will address the federal changes that marketing's been working on. Caroline Ruette is our marketing director. Access Health Connecticut has launched a federal changes landing page on the website. There is a hyperlink to the landing page on that slide. The purpose is to help customers and stakeholders understand the changes and their impact. The impact is outlined by plan year from now through plan year 2028. The page has helpful messaging and resources and includes what customers can do now to prepare to shop for a plan during OE. As we said, it's especially important this year to shop around for a plan. The page includes a video about what brokers do and how to find a broker and how to receive free help navigating the changes. The Access Health marketing team is also working on direct-to-consumer messaging for mail, email, and text messaging. Messaging has already begun to help customers who will be impacted the most by the federal changes to help them understand what they can do. These audiences include the DACA population, individuals whose incomes are above 400% of the FPL and are at risk of losing all subsidies, as well as certain individuals, as we said, who do not qualify for Medicaid and whose incomes are under 100% of the FPL. Federal changes postcard was mailed and emailed out in August, alerting customers that federal changes will likely impact them this year. And a more detailed federal changes letter is going out this month to share more specific information about the federal changes. It contains a call to action and a reminder to seek help from a broker. We should also note that a DACA qualified health plan termination letter is going out at the end of this month to explain to DACA individuals who are currently enrolled that their coverage will terminate September 30th, 2025. Additionally, the senior leadership team has made several presentations on the topic of federal changes, including at a rate hearing hosted by the Connecticut Insurance Department. Updates to brokers, certified application counselors, and community partners are being made via email campaigns. The topic will also be presented during the annual community conference in October. Next slide, please. Moving into OE-specific marketing, the Open Enrollment 13 paid media campaign is supported by a data-driven strategy designed to reach the individuals who need our messaging most. Two core population groups within the target audience include uninsured individuals and households with incomes at approximately 400% of the FPL. Data analysis revealed a 99% overlap in zip codes that have the highest populations in Connecticut of both the uninsured as well as the 400% CLIF audience. That correlation confirms our zip code selection is effectively including communities with the greatest need and enabling efficient use of our paid media investment. We also have complementary channels that have been integrated to reinforce open enrollment messaging statewide. This includes broadcast media such as TV and radio, billboards, and placements in local newspapers and community publications. The influence of earned media coverage also plays a major role in our reach throughout the state of Connecticut. Next, please. On this slide, you'll see Susan mentioned there's a lot of health equity and outreach activity this year. There are 4 newly trained hired mobile enrollment specialists and 23 enrollment fairs planned to assist customers in areas throughout the state. Tammy Hendricks is the Director of Health Equity and Outreach. Our Navigator program has expanded to include 6 Navigator organizations, the greatest number of navigators with which we've ever partnered. This year for open enrollment, for the first time, customers will be able to schedule in-person appointments with the mobile enrollment specialists through the Access Health website so that customers can find locations and times that are convenient for them. Health Equity and Outreach continues to offer virtual monthly healthy chats to the public as an educational resource. And our community partners can look forward to Access Health's community conference to be held in Old Saybrook this year on October 8th. Community partners are also encouraged to attend virtual monthly community partner meetings to keep up to date. Thank you.
Thank you, Tammy, very much. Very important and thorough update. We appreciate it. Are there any questions for Claudia, please?
Sorry, Charlie, I'm very
No,
active
please.
today with questions, but this is a fascinating and important topic that we were taking on today. So just because in recognizing that so much is still fluid, especially at the federal level, we're in a federal government showdown that may result in policy changes or different leverage that the minority party may have to try to get something like the enhanced subsidies back in place or some form of those back in place. And James, I wasn't sure if you ruled out the catastrophic or if we're still debating that. But how are we messaging for and foreshadowing to the consumers that things could still change? Are we building in contingencies, and what are the flexibilities should we have a change in Connecticut state special session, or at the federal level if they come in at the last minute in December to extend the subsidies? How are we sort of messaging this is as it is today, but maybe there's other supports coming? Or have you thought about that?
We have on the technology side, everything we are building into our system, we could turn it off and turn it on as needed. So if the enhanced subsidies get approved by the end of this month, then we could just simply turn it off. We'll be fine. But the communication right now, we want to give our customers clear directions is where things are as of now. So we are functioning. This is where things are now. If things change, we will move very quickly to make the adjustments and communicate the changes as they are happening. It's just that right now things are so unstable. We have to assume and plan for the worst to prepare our customers to take action. So what we're doing mainly right now is telling our customers it's in your best interest to work with one of our brokers free of charge to you and look at all the options available to you in the environment that we are working in, and make sure you make the right choice for you and your family. That's what we live in right now, which means that if things change, then they work with the broker. They'll be able to, then those changes will, the brokers will know about it because we train and communicate with the brokers, and the adjustments will be made at the point of purchase. But in addition to all the communications that we would be doing directly in mass media as well to inform everybody, hey, this is where things are as of this date. Hopefully they won't change.
So if I could play out my nightmare scenario, and maybe you've already thought about this, the Speaker of the House in Congress has signaled an openness on enhanced premium subsidy expansion or doing something there, but he's wanted very much to bifurcate it from the current federal funding that needs to be decided in October by October 1. And I've heard him say recently that it's a policy conversation for December. So if we're talking about this being restored so late into open enrollment, what recourse do we have as a state-based exchange to quickly pivot, turn, and all the potential damage or shopping that was based on some false realities, unwinding and undoing all that damage? damage in a very short period. Can we, as a state, elect for a special open enrollment period to extend past the normal time to give people a chance to come back in if they've opted out under the new realities, if the subsidies are expanded? Or what other flexibilities do we have? Because that's my biggest concern, is that ultimately they may swoop in, but it may be too late and damage may be done.
Again, Claudia, in the past, we have made adjustments in mid-season. So if we need to make an adjustment, we've done it in the past. We are certainly able to do it again. My only if they decide to put in subsidies, it's not just about us. It's about the insurance companies as well. The premiums would have to be refiled and get approved. We have to reload. So the mechanics of it, we can make it happen as quickly as possible. So we're not concerned about that. But the communication part, that's the part that we have to work very diligently with our marketing folks to make sure our customers are not confused by it. And also a lot of this depending on the timing, the effective date, start time of any changes that go into place, whether it's January 1st, on July 1st, or January 1st of 2027. So we don't know. But whatever happens, as we have done in the past, we will make the adjustments on the fly and again, take an approach that will be most advantageous to our customers.
Okay, that's very good. Thank you, James. Then just a last clarifying thing that's still outstanding is, when do we anticipate making a firm decision on the flexibility about the hardship waiver and catastrophic? Because I imagine that would have downside ripple effect for potentially the carriers and filings as well.
Right. Yeah, I have been talking with Anthony in particular about this, and we are looking at the impact this would have. Then I'm hoping to have a decision made by mid next week.
Okay, so we'll have a firm yes, no for the 26 plan year.
Right.
By the end of this month.
Correct.
Okay. Thank you. Appreciate it.
Claudio, thank you. Are there any further questions or comments on this topic? A very important topic. Really appreciate the update. I think we have time for one more, James, and maybe only one more, but I'd love to hear the ICRA update as well. Thank you. John?
Excellent. Thank you, Charlie. Good morning. My name is John Carbone, Director of Small Group, Broker Support and Product Development. On July 1st, we've officially launched Business Plus. Since then, our focus has shifted from building to driving adoption, refining the platform, and setting the stage for long-term growth. I'll cover today a few areas. A couple of them will be adoption, market strategy, support in the next 90 days. Adoption. We've trained over 250 brokers since the launch, with another 350 scheduled this year. Early quoting activity is extremely strong, especially among non-for-profits, small businesses facing double-digit premium increases. Employers value budget control and predictability. Employees value choice and fit. Together, these strengths are fueling a healthy pipeline and gives us the confidence in reaching our 5,000 member growth by the end of 2026. We recognize that this represents a new way of delivering benefits to Connecticut. Employers will need time to adapt, but the need for affordable and predictable options is strong, and we're confident adoption will continue to grow. Marketing. Non-for-profits are a priority, and our growth market segment is where we feel is going to be most of our growth is going to come from. Many are struggling with the renewals and the unpredictable benefit cost for 2026. Our outreach plan includes partnering with statewide non-for-profit associations, hosting educational webinars and in-person training, equipping our brokers with non-for-profit specific cases, studies, and saving examples. Working with our chambers to position Business Plus also is a mission and is part of our mission in driving them to the platform and showing them how they can save with these plan options. This approach is already resonating, and we're expecting non-for-profits to become an early adopter. Operations and support, our sales strategy training and onboarding efforts are designed to guide brokers, employers, employees effectively. Dedicating resources remained focused on small group leads and day-to-day service and operations. The support team now routes cases directly to specialized brokers and staff members for fast and accurate assistance. We recognize that ICRA can feel very complicated for many small businesses and non-for-profits, but with our specialized team and broker and training, we feel like we can answer all the questions fast. We're also advancing conversations beyond Connecticut, federal collaborations. We conducted multiple demos with the Center of Medicare and Medicaid, exploring the potential for the platform to be leveraged for the FFM states. Also, we're working with some of our state-based partners and collaborating with them. This week, we traveled to Maryland and did an in-person demo with their executive team, and we've had a positive feedback from them and hope to continue to work with them in the future. Over the next 90 days, our focus will be to complete and launch the savings-focused quoting options, pilot a carrier portal for our selected partners, continue to expand our non-for-profit marketing and outreach, and deliver the 350 scheduled broker training sessions that we're going to continue to do. Also,
John,
yes, sir.
Forgive me for interrupting, but
No
I'm afraid we may have to leave it there because I'm worried about losing a quorum for ending this meeting. So I really appreciate it. I appreciate the update. Thank you very much. But in respect of people's times, Arson?
Yeah. Yes, Mr. Chair. So would you like to go to the adjournment slide?
Yes, if you would, please. Thank you very much. Again, because I don't want to lose our quorum here. Thank you. If there are any further business or questions, if not, I would ask for a motion to adjourn this meeting.
Motion to adjourn, Paul.
Thanks, Paul. Second?
Seconded, Tom McNeil.
Thank you, Tom. Really appreciate all the input for everybody today. Motion and second is for further discussions. Charlie Klippel, yes.
Thank you. Paul Philpott?
Yes.
Ron Grader?
Yes.
DJ Gifford? Steven Hernandez? Matthew Brackman? Thomas McNeil?
Yes.
Dina Berlin?
Yes.
NJ Barton Reeves?
Yes.
Thank you. Kathleen Holt?
Yes.
And Claudio Gualtieri?
Yes.
Thank you.
Thank you all for a very good discussion today. Appreciate it.
Thank you.
Thank you.
Bye-bye now.